This presentation covers communication in hospital pharmacies. We're going to look at what needs to be improved and different ways to improve it. So what is the issue? The issue is that there are too many medication errors in hospital pharmacies. On average, 90,895 patients are harmed every year as a result of medication errors. This results in billions of dollars used to correct the mistakes. This shows a need for intervention. Another issue is rural hospitals are at a disadvantage due to lack of technological advances. The goal is to bring them to the same level as urban hospitals and integrate them with larger hospitals. An example is a story about Emily. Whenever she was a year and a half old, she had a curable cancerous tumor. She went through 6 months of chemotherapy and surgeries. She was cured, but she had one last chemo treatment. On this last chemo treatment, her sodium chloride bag was filled with 23.4% versus the normal 0.9%. This dose was lethal, and it was the result that a pharmacy technician had made. Instead of using a pre-made bag, she decided to make her own, and she made a dose that was too strong. She was unaware that she made this strong dose, but later in interviews, she was asked if she had known that this strong dose could be lethal. She said that she was unaware of this, and this shows the need for standards in education and monitoring. Medication errors can occur at any point during the prescribing process, from prescription from the doctor to administration to the patient. A way to limit medication errors is to limit or to have an organized work environment in the pharmacy to allow work to flow easily from one step to the next, limiting distractions, and be efficient. Another way to limit medication errors is to allow pharmacists into the healthcare team, such as using them to obtain medication lists. It has been shown that 51% of errors have been limited due to pharmacists collecting medications, looking for allergies and adverse drug reactions.
So when looking to improve communication in hospitals, it's important to remember that pharmacists and the other healthcare professionals like nurses and doctors are involved as well as the patient. It's important to keep the patient in the loop as far as their care. So improving communication improves patient health, which is the #1 goal of hospitals. It also improves interprofessional collaboration, which is good to have so that the team of professionals is working well and they have kind of like a high value to their work, and it's also good for the economy. It was noted that poor communication has cost hospitals approximately $1.7 billion each year. So that just shows how important the improving communication is. One way that communication can be improved in hospitals especially is remembering that pharmacists are a huge resource for drug dosing questions and administration questions. So having a pharmacist who is readily available to the doctors or nurses helps with limiting errors. Additionally, when all members of the healthcare team have access to the electronic medical records, the transition and handoff between the coworkers is decreased, and the pharmacists are able to check the electronic medical records for anything with the patient's allergies or other medications that they're taking. Additionally, team steps decreased handoff errors by 8%, and telepharmacy is useful for rural hospitals at night. So, to conclude, implementing standards decreases medication errors, and using technology such as team steps and telepharmacy improves healthcare, and overall communication improves interprofessional relationships, the economy, and patient health. These are our references.